here. I'm Somarani from Imphal, Manipur, and today I'm going to talk on the topic status of COVID-19 in Manipur. As we all know that in December 2019, COVID-19 was identified in Wuhan, that is in China, as a respiratory tract infection. It is an infectious disease caused by SARS-CoV-2 virus. So the first case of COVID-19 in India was reported in India in Kerala among 3 medical students who came back from Wuhan. In India, that became the first, some breaking noises here, sir. Is it from my side? Hello? Sir, can I continue my presentation?
Yes, continue.
Some breaking noises here, sir. That's why I'm talking. So India became the first country in the world to record over 4 lakhs new cases of coronavirus infections in a single day on April 30th of 2021. Other part of India, Manipur was also affected by the coronavirus pandemic. Manipur, which is situated in the northeastern part of India, has the populations of only 28,55,794 according to 2011 census, out of which 57.2% live in the valley districts and the remaining 42.8% in the hill districts, and it comprises of 16 districts. So in Manipur, a 23-year-old girl from the Imphal West has been identified as the first confirmed case of the novel coronavirus on 24th March 2020 with a travel history to UK. So my paper tries to display the district-wise status of COVID-19 positive and death cases in Manipur from April to June 2020-21. And I'm also trying to find out the probable reason for the trends of occurrence of infections and disease among the 16 districts of Manipur. For this paper, I have collected data from Delhi status update on COVID-19 by the Integrated Disease Surveillance Program, Ministries of Health and Family Welfare, Government of Manipur, based on cross-sectional method. For the control measures, different control measures have taken by the government. So to prevent the spread of COVID-19, countries have supplemented diverse policies regarding non-pharmaceutical interventions measures. Awareness and understanding of the risks at the community level goes on a long way in enhancing prevention. In Manipur, curfew was first imposed on the 8th of May 2021 and repeatedly extended in the districts of Manipur, Imphal West, Imphal East, Bishnupur, Kakching, Thoubal, Chutampur, and Utkal districts. On June 30, the cumulative numbers of people getting vaccinated in the state has gone up to 6,66,625, of which 5,82,280 have received the first dose, and 84,345 have received the second dose of the COVID-19 vaccine. An interesting fact about the Manipur is that the local governmental organization distributing eatables to the people living in the containment zones in and above the welfare activities taken up by the government. So this chart represent the results that I've collected from the district-wise COVID positive death and the positive cases from April to May. So this figure 1, this shows that, okay, what happened? Just 1 minute here. Okay. So this figure 1 shows that the total numbers of positive cases of all the districts of Manipur during the month of April 21. So the total number of positive were 3,186, in which number of dead cases were only 31. Among all the districts, this blue highlighted area is the Imphal West district, that is the most affected area. So the maximum numbers of positive cases, there is 58.94%, followed by this Imphal East of 18.55%, whereas Bishnupur, Kakching, Champur have 4.55%, 4.27%, and 4.23% positive cases respectively. In the remaining 11 districts, there were collected very small numbers of positive cases, that is 9.35%. So regarding the death cases during this month, as shown in this figure, 48.39% were found in Imphal West only. Then 25.80% in Imphal East, then 6.45% each had occurred in Bishnupur, Kakching, Thoubal district, 3.23% each in Chuchampur and Jiri district respectively. In the remaining 9 hilly regions, no death cases were found during this month. So by the month of May, the positive cases jumped up at 18,640. During this month, Imphal West district has the highest positive cases of 38.34%, followed by Imphal East with 25.96%, Chuchampur at 7.41%, Bishnupur 6.43%, Kakching 6.02%, and Thoubal 5.77%. Lowest positive cases occur in Faizol. Lowest positive cases occur in this Faizol with 0.21% as depicted in this graphic pictures. So this figure, it displays that the death cases were in Imphal West too, the highest death cases. This is blue darken is the Imphal West, represent the Imphal West district. It is stood at the highest of 38.11%, followed by Imphal East with 29.116%, then Bishnupur with 7.67%. Other 3 districts like Kakching, Chuchampur, and the Thoubal were 6.65%, 6.39%, and 6.13% respectively. In Utkal district, death cases were not found, is 2.05%. 2 districts like Kangpokpi and Senapati with 1.53% and 1.02% were found in this month. In Chandel district also 0.5%.
Madam, please hold on. Madam, please hold on. May I please request Dr. Lakshmi Narayan sir to mute, because it's disturbing actually.
Actually,
Dr.
I don't know.
Lakshmi Narayan.
Actually, I'm not very much familiar with this technology. That's why I'm bearing all these things, no, sir.
Yes,
I don't know. I don't know how to.
Please continue, ma'am. Sir is
please continue
now. Please continue,
Okay.
ma'am. Please slideshow. You can slideshow because we can also see your slides in full screen. Please click on slideshow and continue your presentation now. Thank you, ma'am.
Okay. Just 1 minute, sir. How is it okay, sir? So
yes, absolutely.
Okay.
Thank you.
So in Chandil district, also 0.5% of death cases were found, but among 3 districts like Kamjong, Tamelong, and Tengnoupal, number of death cases were found the same is 0.26%. In the 3 districts, Ziri, None, and Ferzo, number of death cases were found same as in the month of April. Coming to June, the total number of positive, okay. The total numbers of positive cases also increases from 18,640 to 19,001 during May to June in all the districts. In June also, the highest numbers of positive cases as well as death cases were found in Imphal West with 6,249 and 103 death cases respectively. Second highest numbers of positive and death cases were in Imphal East with 3,631 and 88 death cases. And in this month, lowest numbers of positive cases were found in Ferjol with only 3% and no death cases. So this may be due to the better healthcare facilities available. It may be like this. Okay, in coming to discussion, so maximum occurrence of these positive cases in Imphal West, it might be due to the maximum density of population, social gathering without maintaining SOP, ignorance and negligence might be the reason of abruptly increase in the numbers of death toll of 391 in the month of May. Though the number of positive cases arose in the month of June as compared to May, positive cases reduced in Imphal West district, which might be due to the awareness of the causes of the disease. Then from March 2020, when the first case was detected in Manipur to November 2020, the death toll stood at 257. But the second wave has ensured that Manipur has come agonizingly close to this number in just a span of 22 days, with death in 3 weeks, nearly equaling the number of deaths recorded in about 20. So I would like to recommend that an integrated command center headed by a competent authority which will coordinate with all these health facilities in the state, and involvement of the local clubs, civil society organization, and community organization, each are very crucial. Then important tools for fighting the pandemic are authentic real-time data. District-wise distribution and a course of days is necessity. So in conclusion, maximum occurrence of COVID-19 positive in Imphal West district during the early phase of the second wave in the month of April may be due to general fatigue in following COVID-19 appropriate behavior among the general population. And not only that, the density of the population of around 992 inhabitants per square kilometers, that is according to 2011 census, as well as being the capital of the state, added to the growth of the positive cases. And another cause may be new contagious variants of COVID-19, which was officially declared as prevalent on June 18, 2021 in the Indian Express. So there were a lot of unvaccinated individuals among the general population due to lack of trust and rumors. And lastly, stricter polishing of the NPI measures will have been more effective in controlling the transmission of the disease. Thank you all.
Thank you for your nice presentation.
Thank you, sir.
And who are the others? Sir, we will discuss or question and anything in last, or we should include in this time period also? Hello.
Sir, there is one person presenter ready. Both the presenters are available now, and I request Dr. Sasmita Sahoo from Utkal University. She will present.
Okay.
After that, Gladis Mathew is also ready. Yeah.
Okay. So, Madam Sasmita, kindly start your presentation. And
Good
your
afternoon,
time
sir.
starts now, and
Yes, sir.
you will finish by 1:20, not more than that.
Okay, sir. Thank you, sir. Sir, I want to share my PPT.
Okay. One minute.
कल से तो लगेगी ना उस पेपर पर, जो चिट्ठी आएगी वहाँ वाला हमारा पूरा तैयार है, GMC 32 वाला। तो फिर वो देख लो। मतलब ये है कि चिट्ठी जिस दिन है उसके नेक्स्ट डे चल के हम जमा करते हैं। और पेपर में भी देख ले जितना हो सके, फिर मैडम को भी भेजना होगा ना वो पेपर। कम से कम एक हो जाएगा ना तो बहुत बड़ा झंझट से हम निकल जाएंगे।
Hello. What is your ID, Susmita?
Sasmita 001 sahu@gmail.com.
No. Here in this, I'm not able to see your this.
Sasmita Sahu, sir.
Oh my God.
So her ID is displayed as a user.
Tanya,
Vedat sir, her ID is
the
being
blanket
displayed as
also live
user.
होने यहाँ।
Here, I'm not able to see. Oh, 1 minute. Gladys.
आपने नया खरीदा।
Hello, Gladys Mathew.
Yes, sir.
Are you ready?
Yes, sir.
Excuse me, I will make a co-host. So yeah, you go ahead and share, because I'm not able to see her, some problem here. So I made you co-host, Gladys, please.
Okay, sir. Okay. Sir, it is still showing disabled.
Oh. Oh my God. Oh, now I am able to see Sasmita Sahoo. Yeah. Sorry. Please forgive me. Sasmita Sahoo ji.
Yes, sir.
Yeah. Please go ahead. I have done.
Okay, sir. Thank you, sir.
Lunch.
So she is Mathew, sir. The presenter is Gladis as Mathew.
No. Sasmita Sahoo.
Okay, sir.
Sir, I'm not able to share my PPT.
So kindly present your presentation without slide.
Good afternoon, everyone. Respected chairpersons and everyone present in the virtual and offline mode. My topic is maternal health services during pregnancy among the Juang tribe of Banspal block of Keonjhar district, Odisha. And now comes to the introduction. Maternal health is the health of women during pregnancy, childbirth, and the postpartum period. And the maternal health care services are the antenatal care, delivery care, and the postnatal care services. Maternal health has been becoming a global concern because the lives of millions of women in reproductive age can be saved with maternal health care services. Despite efforts that have been made to strengthen maternal health care services, maternal mortality is still high in most of the developing countries. Every day, approximately 800 women die from preventable causes related to pregnancy and childbirth, and 99% of all maternal deaths occur in developing countries. Maternal health care services has been the most important interventions to decrease the maternal morbidity and mortality. The objectives of my study to understand the problem of maternal health, to know the facilities for diagnosis and treatment of health problem, to know the traditional restrictions during and after pregnancy. The area where I have done my field is Keonjhar, Banspal block of Keonjhar district, and the communities. I have done my work on Juang community. Now comes the result part. The age at conception. Age is an important factor for the fertility. Age is the single biggest factor affecting a woman's chance to conceive and have a healthy baby. early pregnancies among the adolescent have major health consequences for adolescent mothers and their babies. Pregnancy and childbirth complications are the leading cause of death among the girls aged 15 to 19 years globally. Early childbearing can increase the risk for newborn as well as the young mothers. Babies born to mother under 20 years of age face higher risk of low birth weight, preterm delivery, and severe neonatal condition. Here, the mean age at conception of the Juang woman is 19 years. Now comes to the antenatal care. Antenatal care is an opportunity to promote a positive pregnancy experience and improve the maternal and child survival. Care in the antenatal period is also important for supporting the long-term growth and development of child. It is the platform that linking the woman and her family to the healthcare system and possibly promotes higher utilization of essential services like breastfeeding and nutritional counseling, postpartum family planning, and childhood vaccination. Globally, only 62% of pregnant women receive the antenatal care, and here the Juang women, around 90% of women receive antenatal care. Sir, next slide. Now comes to the immunization part. The immunization during pregnancy is a simple and effective way to protect the mother and child from certain infections. Vaccination during pregnancy is a cost-effective strategy to improve the pregnancy outcomes. And the anemia in a pregnant woman is a severe public health problem. So iron and folic acid supplementation during the pregnancy can effectively reduce the risk of iron deficiency and anemia and improve the gestational outcomes. Here 88% of women undergo immunization, and 31% of them were intake the iron and folic acid tablet. The Juang woman, around 57% delivered at home in the presence of in-laws or neighbors, 38% in the presence of skilled birth attendants, and 5% preferred doctors for their delivery. The regions for utilizing the healthcare services. First of all, the Arnis, the tribal women who received antenatal care services from government facilities did so due to the awareness that modern medical care during antenatal period, institutional delivery, and postnatal care all help in achieving a better outcome for mother and infants. Government health facilities like free treatment, good quality services, uh, uh, including effective ASHA, Anganwadi worker, and the A&M doctors, drugs, ambulance services, provision of monetary incentives under Janani Suraksha Yojana favor the improvement of the health conditions of Juang women. And the reason behind the underutilization of maternal health care services, the Juang women who did not utilize one or more maternal health care services were of the opinion that antenatal care and delivery at any hospital were unnecessary. They believe that medicines and injections are harmful to the health and will cause other health problems. They also believe it to be against their culture and tradition. They never consulted health professionals for any diseases. The sole reason stated by tribal women who wanted to utilize the service but could not was the lack of availability of public transport facilities. The another reason is the unfriendly behavior of the staff in government hospitals. Sir, can you show my photo plates? So the the age at conception and pregnancy varies greatly all over the world. In Juang women, the age at first conception was found to be 19 years. In the present study, results from the review found that women in urban areas had their first child over a year later than their rural counterparts. This is influenced by many factors like socioeconomic conditions, cultural, sexual, reproductive health, and education. Besides, health workers are also an important contributing factor for the better utilization of available services. It is expected that awareness and better accessibility to healthcare facilities will enable preference for institutional delivery rather than home delivery. This in turn will be a cause for reduced maternal mortality and infant mortality. Sir, can you show my a slide, sir? Hello. Hello, sir. Am I audible?
Yes, you are audible, but you continue without slide. The time is very less.
Sir, I have already completed my slide, but I want to share some photos. Which
Photos.
one the
Okay,
sir?
okay. Yes, sir. What is the problem? Yes, sir.
Sir.
I think photographs are not that important, so we can switch over.
So kindly invite
Okay,
sir next.
So what is the slide number? Hello,
Hello, sir.
what is the slide number?
Uh, mm,
Are you able to see the slides?
16 and 17, sir. 16 and 17.
You are able to see?
Yes, sir. Yes, sir.
Yes.
The first one is the traditional practices of Juang people is to massage oil on the onto the baby and allow the sun bathing after that. And the second one is uh, and the second was the both women showed were married early and had already conceived by the time they were 15 years of age. And that's all about my presentation. Thank you, sir.
So
And sorry
thank you.
for technical issues, sir.
Sir, kindly invite third one.
Dear Gladys, Mathew.
Yes, sir, I'm here.
Yeah.
So
So
can I get the SS to share my screen?
yes, 1 minute. I will do that.
Okay, sir.
I'm extremely sorry, Sasmita Sahuji, for the inconvenience from my side.
No,
No,
sir.
no, sir.
Not at all. It is digital India. There is some problems.
My
always.
laptop got switched off, so in the midst, and I was sorry, but I apologize for the inconvenience.
No, sir. No, sir. No, sir.
Let's move to others.
Gladys ji, I have made you co-host. Go ahead.
Yes, sir. Yes, sir. Sir, is my slide visible?
No.
Oh my God.
I think it would be better if you start without slide.
Oh,
The time is very less. You have to
okay,
finish by
okay. Sir,
1:35.
could you please share my slides from your end?
Yeah. I'm accessing your mail. Yeah. I found it.
Okay, okay, sir. Okay.
In the
A very
meantime,
yes, sir. I'm starting my presentation. Okay, a warm good afternoon to one and all. I am Gladis Mathew, doctoral fellow at Department of Tribal Studies from Indira Gandhi National Tribal University, Madhya Pradesh. And the topic of my presentation is Sexuality, Desire and Orientation, an Anthropological Study on Kothi Community. So before directly going into the slide or the presentation, I would like to ask you all a very basic question, that what does it mean to be a man or a woman? Or what does it mean to be a female or a male? So I guess the probable answers would be that each being in this universe is indeed unique and an integral part of the nature. It would thus be wrong to judge and discriminate people who may be different from the stereotype, which is again man-made. So in this picture, you can see 5 people sitting together, posing and smiling with their identity cards in their hands. But what if I ask you to determine their sex or gender? We will get a very mixed answer, that by seeing their morphological or biological traits, we can guess that 3 of them are male and 2 of them are beautifully well dressed as females. So, my dear friends, all these people belongs to the Kothi community, which is a subcategory of the transgender community. So today we will be dealing with this subcategory of the transgender community, that is Kothi community. According to the NAACAFI judgment of 2014, there are more than 70 subcategories of the transgender community, and Kothis are one of them. Kothis are people having both the characteristics of man and woman, but suffers from an identity crisis. Thus, they encompass those people whose identity and behavior do not adhere to the stereotypical gender norms. Sex is what one is born with, gender is what one recognizes, and sexuality is what we discover. This was a statement made by one of my Kothi community of this study. It came straight from the heartful of his conviction and philosophy, making no attempt to quote any author or dictionary. This significance in his comment was with the ease which he conceptualized the 3 constructs which theorists and researchers grapple with. Sir, next slide, please. So in this presentation, we will try to answer some of the questions like, is sexuality my own choice? Body is just a tool which carries the personality, isn't it? And rights are for all. Are we not the part of the section all? Next slide, please. So before directly going into the results, it is very important to know some of the operational definitions, as most of us, when we talk about a transgender community, believe that a transgender person is having some abnormalities or aberrations by birth, or they have some birth defects, but this is not exactly correct. The person which have some birth defects, or they are having incomplete genitals or no genitals, or some kind of aberrations, they are known as intersex people. So it is not necessary that every transgender is an intersex. It is their behavioral pattern also which determines them to be a part or be a section of the transgender community. When we talk about the transgender community, the most popular concept is of hijras. The hijras include people assigned male at birth who may or may not undergo castration and modifications such as breast implants and all. And Kothis are an effeminate man or boy who takes on a female gender role in some sex relationship, often with a desire to be penetrated member in a sexual intercourse. Transgender people are person appearing and identifying as neither man nor woman, presenting a gender either mixed or neutral. And when these transgender people undergo surgery that is known as SRS, sexual reassignment surgery, then these people are known as transsexuals. Next slide, please. The main objective of the study is to find the social and economical problem of the Kothis. The second is to find out the identity making process of Kothis, to know about their sexual orientation, to assess the rights enjoyed by the Kothis and various government programs meant for them. Next slide, please. The method and methodology, I have taken 60 respondents and 45 out of 60 are registered and 15 are non-registered. I want to make it clear that 45 people are having the card of transgender community and 15 were not having the card of transgender community, but they were a part of the transgender section. And but however, they were having the card of being male, but they have applied for the card. According to NALSA judgment, it is not necessary that if you feel like you are a transgender person, you don't have to go for a medical examination. You have to just do some documentation and you can get the card. So I have interviewed 60 respondents and snowball sampling has been employed in this study. The study area is Bilaspur town of Chhattisgarh state. Next slide, please. It is important to know that why we are discussing it with an anthropological perspective, because gender, a learned social role, helps to explain why individuals can vary from what is otherwise considered the biological destiny of their sexes. Gender policies and sex can create a ground for morality. That is what gender can vary from physical sex. In anthropology, mainly two genders, masculine and feminine, are discussed, but there are some individuals who are not included in both the categories. They are born in the society, but they are excluded. So their identification should be found out in anthropological perspective. Next slide, please. The social importance of my study is to restrain the social frustration that has evolved centering the Kothis residing in the hidden corners of Bilaspur state, Chhattisgarh, so that they can create a place themselves within the mainstream of the social strata. This study also strives to make the society and government aware of its loopholes while dealing with the Kothis and to see to it that this vulnerable community is not deprived of their basic human rights. Now we'll go to the results and discussion. Next slide, please. So we'll talk about the childhood experiences of Kothis. Childhood experiences of Kothis are really haunting as people mock at them for being different and unique. The qualitative analysis of the data collected from Kothis shows the common childhood experiences faced by them. The childhood which is directly related to their sexuality, this created a feeling of separation in their mind. Inequality in various forms generated mental construction which made them separate from males and females. They were the subject of fun for everybody, including the teachers, seniors, peer groups, and relatives. This forced many of them to change their school till secondary level with an aim to get equal treatment and harassment-free environment. Next slide, please. Now we'll discuss the responses of their family members. We all know that family plays a very important role in everybody's life, but with respect to the responses of the parents, the Kothis had no hesitation to share their feelings which many times went against their parents. The family members, when realized about their child's problem, they kicked them out from their houses without thinking about their future. But on the very other hand, we can also see that there are many supportive parents who tries to give proper counseling and encourages them to lead their life the way they want to. Many Kothis shared that their parents were not in a position to accept the psychological change they had, and basically due to the social apprehensions and the fear psychosis. Next slide, please. Uh, as in the slide, we can see that they used to leave their house and adopt different occupation at a very early age, as most of them are left alone by the family members at an early age. They are not able to complete their basic education and ended up involving themselves in the section of beggary and sex work. So the table shows that around 11.6% at the very initial stages after leaving their home adopt the work of labor, 5% became housemates, 13.33% become cook, and 15% were involved in beggary, while a larger section of the respondents were involved in sex work, constituting 21.66%. Now, next slide, please. Almost in this slide, we can see the social and medical issues faced by Kothis. Almost every Kothi has faced the violation of equal treatment in the society due to their effeminate manners and habits. They faces the social violence as they are not educated enough to understand the rights given by them to the constitution. Some area of violation are listed in the table. Okay, I guess that slide is missing. Okay, no problem. Yes, sir, the next slide. Yes, sir. And we can see that there is violation of right to equality, right to freedom of expression, right to freedom of religion, as we never treat them equally, and they are not allowed to use public properties. They are not having separate washrooms. They feel so uncomfortable. They feel like going into using female washrooms, but they are not allowed to do that. And the treatments at the hospitals, they are most involved in sex work, so they are facing many problems like HIV and STDs, but they are not given proper treatments, and they if the government is providing them free medicines also, they prefer to go to a private hospital rather than the public hospital or the government hospital, because they feel that in private hospital they can maintain the secrecy of their disease and their mental status, while in the public hospital they are not treated equally. And somehow some Kothis have told that even the doctors don't treat them equally, and they are not given beds when they wanted to get admit in the hospital, so they prefer to go to a private hospital to maintain the secrecy also, and for getting better treatments. So in this slide we can see, so the previous slide please, that 46.66% are affected by HIVs, and 21.66% are affected with STDs, as they are mostly working as as sex workers. The medicines for HIV and STDs are free, but as I told you earlier, so but they still prefer to go to the private hospital. Next slide, sir. Next slide. Okay, now I want to conclude that mathologically we believe God has created men and women, but biologically there is a section of population which is different from men and women. They are popularly known as transgenders, entangled with various stereotypes to their identity. Though human being is born with a sex, but gender is built over the time through socialization. Every society specifies certain gender and sex related duties and responsibilities, which is clear in the case of male and female. But as per the census 2011 of India, there are around 500 lakh of transgender people living in India itself. So historically, transgenders are attached with biological, social, psychological determination, and Article 21 of Indian Constitution recognize the right to life and liberty and treat every transgender like any other men and women. But in spite of this, the transgenders are subject to humiliation, exploitation, and deprivation in all the aspect of their life and living. So this is my suggestion to all the upcoming anthropologists or scholars of anthropology to just do some study on that section also, so that we can help the policy makers to frame some laws for them. Though Nalsa judgment is there, but still there are a large section of transgender community which is unknown, and still they face many discrimination. So I have some recommendations based on my study. Next slide, please. That Kothi should be provided with low housing under Atal Awas Yojana in a separate colony. This will reduce the inter-community conflict between the transgender community and the non-transgender community, because when they are giving housing under the Atal Awas Yojana, the non-transgender community is not allowing them to make their home over there, and there is situation of conflict due to this. And Kothi should be provided with small entrepreneur based livelihood programs so that they don't get into the trap of sex work or beggary. And all forms of ID proof like voter ID card, health card, smart card.
Matthew, kindly finish within 1 minute.
Okay, okay, sir. Okay, sir. Koti should be given the right to travel in ladies' compartment also, and they should be given free aid, protection from the violence, and free legal aid, so that there will be equality in the society. And in order to promote a higher education among the transgender community, they should be provided with scholarship and waive out from various educational fee. Thanks a lot, sir.
Thank you. Sir, what is the time for discussion? How much time you will provide? Bataiya, sir.
Sir, maximum 10 minutes, sir.
So regarding first paper, that is Somarani Devi, is there any suggestion or questions? No? Is there any question or suggestion for Somarani Devi? I think there is no any question or suggestion. So now come to the second participant, that is Sasmita Sahoo. If not, then come to the third one, last one. Is there any suggestion or questions?
See, I have one question. I am a Dr. Gandhi Koda Ananda.
For whom, sir? For first, second, or third participant?
The last participant.
Okay, okay,
Yes,
okay.
sir,
So
yes,
kindly,
sir.
but in very short manner, sir, because the time is running very fast.
Oh, I will ask only one. See, her study it was very interesting, and the transgender community, as a being a lady, she did the data collection and all. It is very difficult task. However,
so we must congratulate her, sir.
Yeah, I must have congratulating her to she did a very detailed presentation. In the detailed presentation also, it is motivational. It is like a motivational speaker, and her the findings and all. Even a lady interviewing and observing of the transgender, it is so difficult. So she did very well, sir. But I have one small question for that.
Yes, sir.
What type of questionnaire or schedule you adopted for conducting this study?
Sir, it was unstructured schedule followed by interviews and case studies.
Now, in interviews,
Yes, sir.
whether you used questionnaire or schedule.
No, sir, schedule, sir, because, sir, most of them were illiterates, so they were not able to fill the questionnaire by themselves. So I have used unstructured schedule.
Schedule, it is an objective.
No, sir, not objective, sir, open-ended.
Open-ended, so that you
Yes,
have filled.
Yes, sir, I have filled.
See, I think it would have been for observation, non-observation method.
Yes, sir.
That would be easy way by putting a ranking system to get the eliciting information to the transgender community. That would have been much better.
Better.
Okay, sir. Okay, sir. Thanks a lot, sir, for your suggestions. I will
Sir,
incorporate
may I
this.
conclude now?
I appreciate three of the presenters, Somarani, Devi. Thank you for your presentation on this situation of COVID in Manipur. Particularly, Sasmita, Sahooji, sorry for the inconvenience and thank you for your presentation. Good, very nice. And particularly, Mathew, Gladis, thank you for the policy suggestions. That's what we are looking for. Every paper in our notification of the National Applied Anthropology notification itself, we are asking the others to come up with applications. What are the applied aspects of your research? And in what way you are going to improve the living conditions of the people that you are studying? That's what we are exactly looking for. Because at the end of the day, we have to update the government and the media and the general audience so that this is how anthropology will make positive difference in the lives of the people. So in that area, your paper really contributed the policy suggestions and path-breaking research. And also trend setting and asking the anthropologists to shift their anthropological gaze towards the transgenders. That's really Kothi community is very interesting. Thank you for your adventurous attempt and the informative. I appreciate that.
So thank you all, sir.
Yeah, please, Chairman, sir, please conclude.
So, in my opinion, sir, the first paper is based on the secondary sources. They have data, but it is good. Collect some primary data also from the COVID patients. It would be better. Regarding second paper, Sasmita Sahoo, the presentation is good, but without research methodology. So it is lacuna in her paper. Generally, the paper should be at this stage, the research methodology, and as you said, sir, that is the suggestions. So we can include in our final suggestions. Third paper is very good. And just I want to add in this, there are so many researches is going on. Under I have also examiner of 2 or 3 Kothi's dissertations of ISER and one of the Delhi University and one the MPhil of Oxford University also. So now the questions, now the research is going on, and just I want to share with her that now there are provision of transgender laboratories in all the universities. Government has given the funds for that. And last and not the least, thank you very much for giving me this opportunity with Ratiya sir. Thank you very much. Okay,
Sinhaji,
sir.
See, my book has been forwarded by the and the message is written by the Professor Sachidananda Sinha.
Okay, sir.
AN Sinha Institute for Social Studies.
Yeah. He is my supervisor, examiner. I belong to Patna, so I know him very well.
That my book was Ashram Schools in Andhra Pradesh.
Okay, okay, okay.
That is
Thank you, sir.
ICSR grant, publication grant.
Yeah, yeah.
That's why since.
So this is our Vice President, Dr. Ananda Gandikota, sir.
Yes, yes, yes.
Yeah.
So kind of you. Sir, just I want to share kindly in future also, because we are going to organize international seminar, we
Yes,
should
sir.
prepare schedule in advance, sir.
Yeah, I will do that, sir. I will
Surely,
rectify that
surely.
mistake.
No,
then.
not you will. We will be.
Yes, yes, yes,
We,
yes, sir.
we will be not, you are not the alone, we are also with you, sir. So kindly do this for betterment of the seminar, because my research scholars complaining, sir, we have not received anything. And in the last minute, if you say this is your time period, then it is difficult for the new research scholars, sir. This is my only one suggestion.
We will consider your suggestion and we will do the better in the international conference, sir.
And kindly send my food on WhatsApp.
Oh, sure, sir. Sir, okay.
Here at the Andhra University, we have a very nice campus and we enjoy a lot of.
Yeah, we see the photographs. That's why I request you to kindly send our meal on WhatsApp.
Yeah.
I appreciate all the virtual community and your efforts in contributing significant papers. I really appreciate. In a small way, we have initiated this platform, the global platform for applied anthropology, to make positive difference and to promote the future of anthropology, to popularize by making our positive contribution to the fellow humans on this planet. Let us make the lives better. Let us unite together, irrespective of the diversity, and let us come together. Let us make energy and momentum and make positive difference in the near future. Thank you all. Thank you. Thank you.
So next session is start at 3, sir.
Yes, sir. Yes, sir. Yes, sir.
Okay, sir. Kindly send the schedule, sir, after taking your meal.
Yeah.
Okay. Okay. Thank you, sir. Thank you a lot.
Bye-bye. Thank you all. I'm going to end this meeting.